Burnout: Signs, Causes, and Ways to Overcome. Hi, I'm Gabrielle Juliano-Villani. I'm a licensed clinical social worker and I specialize in burnout and chronic stress. Let's go over the topic of burnout, signs, causes, and ways to overcome it. In this video, we'll go over what is burnout. We will answer the question, am I burnt out? The types of burnout, the symptoms of burnout, and how to deal with it. So first off, what is burnout? Burnout describes the emotional, social, and physiological result of a specific chronic stressor. Usually that's about work. People who suffer from burnout usually feel exhausted, angry, cynical, and sometimes there's also a lot of physical symptoms that come along with this as well, like GI distress or chronic headache. Feeling better usually involves a two-pronged approach. So we would want to self-oriented interventions and also address the work stressors as well. Am I burnt out? If the answer is yes to two or more of these questions in the self-evaluation, you should at least consider consultation with a therapist to address your burnout. Have I missed an increasing number of days of work in the last 3 to 6 months? Have I gotten into more conflicts with my work colleagues and or my supervisor lately? Have I had to make up my lack of work engagement outside of work by completing other tasks that I wasn't able to do during the workday? Have I been engaging in escape fantasies or daydreaming more than normal? Have I noticed any depression or anxiety symptoms that are impacting my work? And has my physical health been declining and I have either failed to address it or I haven't followed up on self-care instructions given to me by my doctor? And finally, have I stopped caring about my work performance? Are there different types of burnout? Yes, there are. Burnout can further be divided by its causes, although sufferers may struggle to identify it at first glance. So let's talk about the different types of burnout. Overload burnout. Overload burnout occurs in situations where there is a lot of demand, but not a lot of control in the environment. Signs of this type of burnout are typical in a competitive work environment where chronic overwork is the expectation, and then you are irritable and then frequently late on assignment. Under-challenged burnout. This occurs in entry or mid-level positions where a worker is ready for a new or more challenging environment, but this position is mostly repetitive or boring type of work. If you're in this type of environment, you probably would express your burnout by arriving late, leaving early, or procrastinating on work tasks. Neglect burnout. Neglect burnout happens when we find our work position meaningless or the product is unacknowledged. This type of burnout is really common in a setting where the job is administrative or what you do doesn't clearly contribute to the mission of the organization, or a lot of the work that you do goes unseen. This type of burnout is also aligned with moral injury on the job, where management doesn't articulate the mission or the vision clearly and how the staff member's contribution fits in with those higher level goals. So what are the symptoms of burnout? The primary signs and symptoms that we see are mental exhaustion, decreased productivity, and feelings of powerlessness. There's also symptoms that your loved ones or people in your life might observe as well, like sleep issues, sex problems, bitterness, and having a hard time being empathetic. The physical symptoms look like frequent illness, chronic headaches, back pain, or poor digestion. Early burning signs of wornout may include self-pity, escape fantasies, feeling guilty, not initiating things, feeling time pressured, irritability, or even a lack of sense of humor. Serious and persistent burnout may lead to heart disease, anxiety, suicidal ideation, relational issues, substance use disorder, poor work performance, and major depression. For those experiencing burnout in their personal life or while dealing with caregiving or other stressors, these strategies might help relieve the stress. First of all, develop an individual self-care plan. Prioritize sleep and rest, reduce complexity in your home routine, explore meditation, get exercise in at least 3 times a week, engage in a hobby at least once a week. You can explore journaling or any other way of practicing gratitude. That's really important. And set a hard stop for work communication so that it doesn't bleed into personal family time. Seek community online or in person. Join a support group or make sure that you're reaching out and talking to a trusted friend or colleague. Call or visit a therapist. A licensed therapist will have an objective view and they can help talk you through and work through this as you process your burnout and also give you strategies to mitigate the stress and cope better. Number 4, address your workload and reframe how you view work. Simplify, focus on no more than 3 things at a time. Use time management skills like the Pomodoro method, like time blocking, and structure your day to fit your professional goals. Number 5, address communication issues. Develop and model efficient and effective communication both at work and at home. Final thoughts. You might be able to address burnout on your own with the support of friends, family, and colleagues. However, if the burnout that you are experiencing is leading to fractured relationships or bleeding into your life and impacting your functioning, that is a warning sign that you should seek professional help.